afternoon, everyone. I don't know everyone in the room, but I know plenty of people in the room, so that's good. I'd just like to thank Nalu for asking us to come on behalf of CHEG and EGSAHP, and I'll give you, Alice has already given you the full title of the EGSAHP, but we are the Centre for Aboriginal, Centre of Excellence for Aboriginal Health and for East Gippsland. Okay? But our AKA name is EGSAHP, which is what Alice has already told you. I'm going to tell this as a bit of a story because in our way, I like stories because stories are full of knowledge and we learn from knowledge. Our old people taught us with stories and we teach our kids with stories, and our stories teach us how to live together, how to live on the land and how to do things. So storytelling is an important part of our Aboriginal way. I also, this morning, I live in the bush and love the bush, like most of us. And this morning, you know, the lorikeets came to my back veranda and they're having a good swim in the bird bath today, and they pushed all the little birds out. And then later on today, the magpies will come in and they'll push that lot of birds out. So I see that as a good sign this morning. You know, all those beautiful birds coming into my backyard was a good sign. And then when I was driving down the road, I've got the black cockatoo, and he flew across the road in front of me, and then the galahs came across the road in front of me, so I thought they're all good omens for today. So, you know, it's good to know that our country speaks to us like that. I want to honour, you know, our elders and our ancestors, and that we're on our beautiful country because we live in a beautiful part of Australia here. And as Alice said, I'm the current chair of the Centre of Excellence for Aboriginal Health, or EGSAHP as we call it. And I want to share with you today our vision and our journey so far. And I haven't been the chairperson for very long at EGSAHP. I took over the role, or I was given the role, and I was given the baton. So now, you know, I see it as a privilege and an honour to continue that work. But I want to thank the other directors, and both Jane and Bonnie are here and in the room, and, you know, to and the team EGSAHP that we have, which is made up of people who are committed to changing things in the community. I want to recognise through the pictures, and these pictures, the people with the vision. And the people with the vision, as Alice already said, were the elders, 4 of them mostly, whose commitment to community for a long time has them working all the time with the community interest at heart. And when they see things need to change, they make it happen. They don't sit back and wait for somebody else to do it for them. You know, Dad was a strong leader and a warrior, and he was always determined to see change happen in the community when it needed to happen. And he was fully engaged with EGSAHP right up until he couldn't chair the meeting anymore, and until Jumbo couldn't chair the meeting anymore, they gave it to me. So I consider that, you know, the work I need to do. But it also has, you know, it's not just Dad and Jumbo. You know, Jumbo was a very strong, outspoken support, and he led those changes on behalf of EGSAHP. We'll have Jumbo now. While Alice is doing that, as I've shown you, Mum and Marion, you know, they're elder women of the community, and in the early 70s they advocated for needs of the community by helping to establish GippsTAFE. And they've continued that work in their life work in the community. Mum worked in HAC and Marion worked in health, and Marion continues her work with the community with GippsTAFE.
Sorry.
What? No.
Yeah, there we go.
Thank you. That's why we have young ones, younger. And of course, you know, we have Auntie Phyllis, right, who's worked tirelessly for the Lax community. And she works tirelessly, you know, and she has come on board to help too. So to me, their collective vision was focusing on the health of the community, on looking after young people in the community, you know, and encouraging young people to aspire to work as health professionals. And, you know, another glaring factor to them and was that what they saw happening in the community was that the majority of staff at the health services were non-Aboriginal, and they said, where's our people in health services? So like I said, you know, I'm really honoured to do this work and be part of the vision, and a really hard working group of people. EGSAHP started around 2007, Jane? And we're in 2015, and in all that time, EGSAHP has maintained its vision for the future for the community of people working in health. And when, you know, and it wasn't without its issues, because it's not funded by anyone. It's supported by the Monash School for Rural Health, our regional school in Bensdale. It has no government programs driving the organisation, and it will achieve real change. That's what we're working for, and that there's sustainable change. And the EGSAHP faced many challenges when it was trying to set up. You know, there are always gatekeepers, there are always barriers, but this was overcome by people like Jumbo speaking to people, Dad speaking to people, and with the support of Dr. Jane and Dr. David. So the EGSAHP group is a really hard-working group, always out there advocating for, and with no real funding to establish as an organisation. You know, I think when Jane's not seeing patients, Jane's working for EGSAHP. And, you know, the vision of EGSAHP is to lay down strong foundations, you know, to encourage young people into health careers, to working with families to work together to achieve this, and to create partnerships and opportunities for students and families. The other foundation we want to lay down is to collaborate with health professionals in East Gippsland, you know, who are able to mentor and support and provide experience for young people. And for those who would have gone to the conference, you would have seen that there were people there from these other services, people there from uni, young people, older people, many people that came to the conference. These are the building blocks for EGSAHP to start developing those partnerships. And I think mentoring and supporting students to enter into aspiring to health careers locally is an important thing to do for the future. Also, we need to engage, we will engage with the unis and TAFE sector to support young career people in East Gippsland and to foster their entry into health training. And of course, you know, there are other agencies that, you know, we have been working with to establish some base for the organisation. We have a Backstage crew, and the Backstage crew have skills and knowledge that they provide freely to EGSAHP. That is writing submissions for us for funding for activity and supporting activities that EGSAHP's undertaken. And the elders made it quite clear when they were first supporting EGSAHP that they wanted to help look after the health of the community. That we want our own doctors too, we want our own nurses, our own dentists, and our own allied health workers in the community. So their vision has permeated everything that EGSAHP does. And to improve the health and well-being of Aboriginal people in Gippsland. All the research shows that the health of Aboriginal people improves with their own people. That is a research thing. So if you're into research, have a look. They want to grow the number of Aboriginal health professionals in East Gippsland and in East Gippsland health and medical workforce. To have safe health services for Aboriginal community, both mainstream and Aboriginal control. Currently, they saw that in our community there are limited job opportunities and that there is no other program, health education-wise, that was targeting Aboriginal people for health professionals. This was when they were first establishing. Some things have changed since then. And they wanted to make sure that they said that young people with all the capacity in the world for a great life are coming through the school system now. They saw that, you know, there are many young people now who are able to build a health career. Some of the things, and I've got a flyer there about EGSAHP that you can take away, and that other paper, Jane, that's not the community report on the research, is it? That's
it's an abbreviated version
of the report. Well, Jane's brought some copies there. With others, and as happened already, you know, identifying young people in Gippsland who want to go to uni to do health stuff, working with them and their families to encourage and achieve their aspirations, obtaining support from the schools for the program, identifying local champions to mentor and role model, identifying local health service to provide work experience and mentoring, seeking the support of key individuals and service groups in East Gippsland community to provide leadership, role modelling and ongoing support for young people. And it keeps coming back to what those elders keep saying. They keep saying our young people are the future. It comes up all the time in all the messages. We'll move on. Let's move to Marion now. I did mention that the EGSAHP is located at the Bensdale Hospital in the Monash School for Regional Clinical Health at the back, and they provided EGSAHP with offices and admin support, and they also provide their boardroom for meetings. So we do have offices and a place to meet and a place to call home. One of the first tasks of EGSAHP, as I understand it, and remember I come into it a little bit later, but I probably came into it at the right time, was to undertake a research project around what were the barriers to young people becoming health professionals. What were the barriers to young people having an aspiration or an interest? So we undertook a research project that included interviews, surveys, a literature research, and we had response from 98 parents and students in the East Gippsland area, and we undertook several interviews, well over 40 interviews with families and community. So I'll tell you a bit about that research, because that research informs the work that we're doing now. And what it was about, what we know from the research that's been done before, and there has been lots of research done around this, and what strategies work and what the barriers were to finishing education, and we wanted to talk to the families. So the research was set up to talk to the families, not other people about kids, not other people about, but to the families, to the carers and to the parents. Okay, what we know from previous research, next one. Sorry. No, next one. I'm jumping here. That some of the key barriers came out of the research that young people were reluctant to leave a familiar environment, their home environment, their families, their community. That they didn't understand what their career choices could be in the early years of schooling. That, you know, people waited too late in their schooling life to ask them what choice they might make and what there could be there for them. Not enough information out there about what's available in health careers, the diversity. The lack of subject knowledge for year 11 and 12 kids isn't there. The lack of awareness of pathway courses that were offered. The lack of support. And the lack of support was mostly about lack of support at school. And that, you know, that young people, you know, their obligations to family and community, and that they didn't have financial support to move away. What we do know, no, go back. Sorry. Go back to that first one. Sorry, that one fell out of order. Next one back. What we do know is that the parents said, and the carers said, nothing. There should be nothing that stops their kids from finishing schools. But there were 4 key barriers that kids face. And that was peer pressure, family commitments, relationships, lack of confidence, lack of teachers, and lack of school support. But what was important to us in the research was that they said nothing should stop their kids from finishing school and from going on to working in a health career. That was a very powerful part of that research for us. What the research and came up from previous research is that there are strategies that work, and that's early career choices, culturally relevant career promotional days, promotion and role models, addressing the structural and cultural barriers, promotion to parents and community, career advisors in, with knowledge and expertise and networks with the health profession, integrated approach into health profession, residential school, holistic student support, mentoring and buddy system, community involvement and ownership, industry links and clinical placements, waiving HECS fees, providing scholarship, and a campaign approach to change knowledge, behaviour and attitudes towards working in health. Some of these strategies have been trialled in other places, but for the research we did here, we asked what would support their kids to finish school and what would support their kids to finish uni. And to finish school, there was family support, tutor assistance with homework, financial assistance, career sessions, camps and guidance. And I think most importantly, was a change in teacher attitudes. That came up quite a bit. And to finish uni, family support, financial assistance, relocating, accommodation, tutoring, assistance with studies, being close to family, career information sessions. So these are the things that EGSAHP is looking at and working on to create programs and to create awareness around with schools, with agencies, and with community to get young people into working in health. We'll talk about some of the conference slide. Oh, that'll do. You know, I'm not bad on the computer, but you think I could change that to black? I tried everything, and I thought I don't want to lose it. So, the conference was held in May, and the conference was basically a planning process for EGSAHP. The conference was bringing together the partners, the collaborators, the community, the parents, the students, the health employees and the agencies. And so the planning from the findings of the research set the themes for the conference and the conversations. And Alice, you went to that?
Yeah.
Yeah.
So a great conference there. And especially having the elders there that shared their stories from how it all began. And it was just a really relaxed environment and great conference.
So, you know, you can see from the picture that there were elders, educators, health people, community people, students, trainees, a range of people were there, and people from agencies and people who make things happen. And it was on the weekend, which made it, you know, easier for people to go. So the focus was on 3 key areas. It was on student and family aspirations and career information, establishing the partnerships and networks, and promotion of CHEG and EGSAHP, right? Because the basis of these 3 things is going to establish the work plan for us at EGSAHP. Because remember, we have an organisation, but we don't have an organisation because we do all the work, the directors, and we all have other jobs, and we all, you know, so we do this as a sideline, I guess, but it's important work to do. And, you know, the conversations about what the priorities of the conference were, you know, engaging in conversation with family, strengthening those relationships through networking, and the promotion of EGSAHP to agency and to seek funding for administration and programs. We are writing submissions all the time. We are constantly, or our team, our Backstage team, work continually in looking for opportunities for us. So the conference was very good. Like, you know, we're working in a structured way that we can manage. We're not trying to take on too much, but it's a big task, and it's going to be a task that, you know, we're committed to, and, you know, it relies on everyone working together, I think. And I think, you know, from a community point of view, and as an educator myself, you know, one of the things I do notice is that some kids don't get a lot of good career advice at school. You need to do these subjects to get into this course, or you need to get to finish year 11 or 12 to do that course or to go on, and or finding a different pathway into it. luckily now, you know, there are many traineeships out there that people find an alternative pathway. The university and TAFE have a pathway entry that people can, you know, get into if they're interested. But what we do know is that a lot of families don't know about these things. You know, they're blindly trying to get their kids through school and to support them and to keep them at school, but they're not really engaged with the, you know, the process. And I would say that even for, you know, for the lot of young ones, there isn't that guidance from the school about, and I know they have a big job to do, but there's got to be someone who takes responsibility for that with our kids in school. So, you know, from the elders' point of view, the timing of EGSAHP is right for the community. Right? These things need to happen. You know, I know that my mum and my father would be thrilled to bits to see so many young people now working in health careers in the community, but that they have an opportunity to go on. So if they want to become a doctor or they want to become a dentist, that someone is working with them. So they're not a health worker for 40 years, even though for some people they might like that. Because I remember when I was a career educator when I first got into schools, and well, my son's 40 next week, so it must be that long ago, that I started working as an educator, and I always thought, I don't want to do this forever. I want to be a teacher in the classroom. So, but I didn't get there till I was much older, until I had a family. But eventually, you know, the opportunity came up to go to uni, and I took it. And I had a lot of good support around me. And I think that, you know, for young people to get into something that they love doing becomes a lifelong commitment to it. And I think the opportunities are there for the community now. There are a lot of agencies and networks out there that are looking for young people and looking for people to work in the health area with the community. So, you know, already EGSAHP has made some really good connections with, you know, we now have 2 people in Gippsland in the ambulance service training to be ambos. You know, it's like a flow-on effect. Well, next, you know, we'll see if there's other people wanting to get in, and there are people who are in the ambulance who are working to get more people in. Right? We have a doctor, you know, in Gippsland, a little girl about this big, who came through the secondary school and is you know, overcame challenges to become a doctor. We have lots of allied health workers. We have lots of nurses in our hospitals and community now, and it's increasing all the time. We'll show our last. This is the, you know, the very few people. Of course, Jumbo and Dad are not there with us anymore, but, you know, very few people on the ground working together to make things happen. It doesn't take a lot of people, it takes a good, strong passion and commitment. And then the last one, I think. The conference. Yep. You can see that Kira on there. The ambulance girl. One of the programs that EGSAHP has been doing, and that's working with the Monash, is taking kids, it's called Looking at Health Careers, at the hospital to where the nurses do their training. You know, they get to play with the people, the dummies in the bed, right, and do medical things with them and take their blood pressure and do some checks on them. So they're, you know, an opportunity to have a look at how a hospital might work. So we've been able to engage the high schools with that one. and hopefully that one will, you know, give young people an opportunity to think about, well, I can do this. And then the last two. There you go, there she is. Go back to Ashley. Well, you don't have to, you can just look up the back there. But I love that picture. Because I remember, Ash, when you were at Bensdale High School.
Yeah.
Yeah, and you were, you know, keen to do something, but to stay home.
Yeah.
Yeah, and so I remembered that, so I thought Ash is inspirational to other people in the community. And the work that she does, and then of course we have our other little go-getter, and that, you know, Dr. Cassie Anderson. So where is Cassie located now, Jane? Traralgon?
No, she's in Melbourne. She's doing, oh, hang on. Mornington Peninsula, I think, is she? Yeah.
So, you know, it is inspiration to see, and, you know, those elders are very proud of these, the young people, and as you saw, Cass was involved with EGSAHP too, and she maintains that involvement, and she brings, you know, she makes everyone feel like, you know, that there is a real opportunity here for EGSAHP to grow and to achieve, you know, more people working in health for the community. Do you have any questions you want to ask me? Don't be shy.
Who are the people to talk to for EGSAHP?
EGSAHP, you can talk to Jane.
Yeah.
Jane's our secretary. And you can become members, that's right, isn't it, Jane? We take members. We have a board of directors, but we have members. And it's an opportunity, I think, to contribute to the work of these elders have started. And I think it's an opportunity, you know, because it is only for Gippsland, East Gippsland, right? It doesn't go outside of East Gippsland, and hopefully, and like the ambulance people say, well, let's support the work that's being done in East Gippsland, and then we'll take the model somewhere else and see what else we can grow. But, you know, from my point of view, I feel I've been given a fairly big job to do, and I see the good that this will do for the community, and I see a real opportunity for engaging with family and engaging with students and engaging with the wider networks for employment, right? Because employment's a big issue, but there's plenty of work out there if our young people are trained up and have the opportunity to work in health and work with the community. So do you have anything else you want to ask?
Yeah, I just want to know, do you have a newsletter or something? Because to be honest, I've never heard of
EGSAHP.
No. And I know it's because I work in early years, but I feel a bit frank that I don't know about it. I hadn't heard of it before.
Well, probably because it's, you know, in Bensdale, like we've had that with a lot of departments and other people, haven't we, Jane, where they say who? Okay, well, it's really starting to find its feet now. But it would be good if community people would become part of an organisation that's got a vision for the community in health, and that people want to be a part of to support. And, you know, we see that, like, the research was focused around Bensdale Lakes for this time, but that there might be other things further Gippsland. But EGSAHP is for all of East Gippsland. It's not just for Bensdale Lakes. So, you know, the opportunity, anything we see that we would organise for other communities as well.
I've got a question.
Yeah.
Has EGSAHP developed any plans for the community with people that fall into the top cracks of the education system, say, for example, like the basic learning to read and write, even with the you're reading the right program, is there any sort of Koori support mechanisms in place for people who have fallen through the cracks and want to develop themselves further?
I see that we have an opportunity to pick up on some of that stuff. You know, say someone wants to be in a health profession, but they didn't do the subjects in school, or they didn't have, you know, they didn't have confidence in their skills in those subjects, that we're able to link them up with some strong tutoring to support them to either go back to school or to go to uni to increase their skills in areas. Because, you know, I just remember being at school and I hated maths. I avoided it, but it caught up with me when I went to uni. I had to do it. I had to do it twice because I didn't get through the first time. So, you know, being able to pick up on what skills someone needs, and I know with the girls doing ambulance, right? The girls are training at Catholic Education in Melbourne, that there are skill areas in learning that they need extra help in, and they're currently getting that extra support. The first girl got through school beautifully this year, and she came back to Gippsland to do her community training, to work in it, so that she's working with the ambulance here to work with the community. So, you know, she's doing really well. And she has inspired somebody else to want to do it. We've got a lot of nurses now, haven't we, Jo, at the hospitals around?
Yes, allied health and dental here. Yeah, it seems to be growing. I'm looking around the room and I was looking at Bonnie and I thought, look at all the beds at Aboriginal Hospital. People are really leading the way. But in Sale was saying, well, what's it, Central Gippsland Health Service. And Latrobe have actually gone a little bit different and gone to theatre technicians and theatre sterilisers now. So we're removing just from the allied health field. It's just, you know, it's good for community to be in hospital and see people in the catering section, which we're trying to push for rather than just allied health. So, you know, there's lots of different careers, and I think that's what the kids need to know in the schools.
Yes.
But the good thing is now we've got role models that can actually go into the schools and our own local role models to talk about their experience.
I remember the bedside hospital when married, and that were, they used to be the cleaners in the hospital. All these Koori women were the cleaners in the hospital.
She was saying there was one in every department.
Almost.
Yeah.
And
that's what hoping to achieve.
And I remember at Orbost Hospital, Nettie Martin was the nurse. And, you know, Orbost had nurses. And even here in Bensdale, there were a couple of nurses' aides, not nurses. So there's always been, and I know Sally Hood's working at GippsTAFE as a nurse. So there's, you know, there are signs that, you know, that people are being employed in that area. But I think, you know, it's not just a girls' thing, it's a man's thing too, young men working in health areas and having the opportunity to work in the community in that way, and not just as a health, you know, not I shouldn't say it like that, you know, a health worker who can aspire to be a nurse or, you know, like the industry. Because it's a bit like teaching, you've got to like it to do it, right? If you don't like being in front of 30 kids all day, you know, each term, each week, don't do it, right? If you don't like cleaning up and doing all the jobs that come with being a nurse and that, don't do it in the hours. So, you know, it's got to be something that people like to do. But there are many people, and it is well known that the community relates really well to having Aboriginal people look after them in their health. And I was saying to somebody, you know, it's because the Aboriginal people feel that commitment to that family person or to the community that, yes, you know, there are a lot of non-Aboriginal people who are really good people and do their job and look after things, but that commitment to seeing auntie or uncle or cousin that look after themselves, or go to their appointments, means that, you know, that 24/7 work of Aboriginal people is something that will, you know, improve the health of that person for their family. Okay, I think I'm done, Alice.
That's all right.
So remember, you know, parents expect that their kids will get through school or through TAFE, and that there will be jobs out there for them somewhere. And you know, in organisations and both Aboriginal and non-Aboriginal, because they can't, you know, the timber mills aren't there anymore. So I'm going to stop there, and thank you for listening, and look forward to other people in the community, you know, supporting the work of EGSAHP, and know that it exists for the right reason, that elders saw the need for things to change, and that we, EGSAHP, are working to realise those needs and that change. Because in our communities, as you know, I talked to my mum about this stuff, and she said to me, the old people had to fight hard for everything, right, for the community, and because they recognised the needs of the community, and that the younger ones can do that too. Okay? So look forward to more people supporting and the work of EGSAHP, and we look forward to having a broader and stronger membership, and you know, people supporting and assisting our work, because Jane does a lot of work in her own time for the community, and we appreciate that, but that we know that there are a lot of young people and other people in the community that can support this work. And even though, you know, I'd say EGSAHP's, you know, the vision of the elders and community, but it can also be well supported by non-Aboriginal people too, okay? Because we have a Backstage crew. So thank you.
I'd like to thank Doris for sharing that story with us about EGSAHP and how they've grown, and how, like, it's full of very passionate people that are committed to helping and building our health for our Aboriginal people. And I suppose, you know, we've touched on a lot of what Doris touched on as well, around not just being that front person in health working, not, she's like just.
Yeah, I thought that too.
But many different jobs within the health sector. Or, you know, it's really good to walk into the hospital and see somebody at the front desk, or see somebody when you go in for dinner, go and, you know, bringing in your food and having a yarn, and just holistic, you know, having our people equal numbers of Aboriginal and non-Aboriginal, you know, caring for us. So, and I suppose, you know, you'll join the dots during the day. Like, there are passionate groups and committees and people out there that are really trying hard, you know, to build and make, you know, this journey for us from school to work, you know, to being cared for better after you've finished the workforce. And that's what we hope to achieve out of the networking, is to bring you all together, give you the tools, share information, and work together. Yeah. So you touched on all of that. Yeah. So, Brian, did you want to say anything?
I think one of the really, I suppose, standout points for me was that, you know, nothing should stop the kids from finishing school completely. You know, and I think that's a really, really powerful statement. Nothing should stop our kids from finishing school. So, That was my big takeaway from there. So any barrier can be removed. It's just a matter of how we think about how we remove those barriers to make it easy for our kids to get through school, because that's where change will happen.
And they're the things we will focus on.
Where do you get your membership forms?
Jane,
Yes.
yep. Jane,
Giving you more work to do.
That's all right.
no, but you know, the thing is that, you know, like whilst there's a small committed group of people, you know, Marion and Mum are getting older, and then there's the next line, you know, it's like the army, you know, they're the next line, and we need the next lines to line up behind us to keep the work going.
Okay, so thanks for that, Doris.
Okay.